Good morning. Welcome back to the Broadcast Retirement Network. This is BRN AM for Friday, February 16th, 2024. And our top story today, that lingering meh feeling has a name. Joining me now to discuss this and a lot more, Dr. Paul Appelbaum is with Columbia University. Dr. Appelbaum, it's great to see you. Thanks so much for joining us on the program this morning.
My pleasure.
I think a lot of the people in the audience are probably very familiar with depression and clinical depression. In fact, a lot of us have experienced those feelings. But there is something called PDD, or persistent depressive disorder. Just to establish a baseline, what is PDD?
So, although most people who experience depression have episodes that may be triggered by events in their lives or may simply occur, but then resolve, usually faster with treatment than without. But even without treatment, tend ultimately to go away. Persistent depressive disorder is different in that it doesn't go away. It's a sustained period of depressive symptoms that lasts at least 2 years, with relatively short breaks, if any, in between. And in fact, it can be sufficiently chronic that people will sometimes say to you, I don't ever remember feeling different than this. So it can be a nearly lifelong experience for some people.
Yeah, and I know I've experienced anxiety, depression myself. I'm sure many people in the audience have as well. What percentage of the population does this impact, and is it relegated to older people, mature people, or younger people, or can it just cross the great divide of our demographics?
Now, it crosses the age divide. So the best estimates are approximately 2% of the American population is experiencing persistent depressive disorder in any given year. There are associated conditions that may be risk factors, people who also have anxiety disorders, people who also have substance use disorders, people who also often have personality disorders that accompany their depressive symptoms may be at greater risk for the persistence of depression, but it's by no means an uncommon condition. We're talking about 1 in 50 of our neighbors out there are experiencing this right now.
And if how do I get diagnosed with this? I mean, you have to have, I would imagine you have these feelings of depression. Again, we all experience this throughout our lives, but would you go to a clinical psychiatrist or psychologist? Do you go to your general practitioner, or all the above?
No, I think you're best off, if you can do it, going to a mental health professional, psychiatrist, psychologist, to get a diagnosis. The reality is most people with depression are treated by primary care docs or other non-psychiatric physicians. And that reflects the reality of workforce limitations and access problems around the country. But a skilled mental health professional can ask you the right questions to identify the symptoms that you've been having, to categorize them as depression, and then to look at the pattern and recognize that this is something that is not just episodic, but actually seems to stick with you. That is, it's persistent.
Yeah. Well, Dr. Appelbaum, I need to take a very quick break. When we come back, on the flip side, we're going to talk about treatment of PDD. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings in retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Well, Dr. Appelbaum, thanks so much for staying with us. Really appreciate you hanging around for segment number 2 this morning.
I'm pleased to be here.
And really appreciate this. I mean, I think, though 2% of our fellow citizens experience this, anytime you can shed a light on something that's so important, and mental health is certainly top of mind for so many in our country and around the world. Let's talk about treatment. So most people understand that if you have some level of depression, you can get treatment. You can go to regular therapy, and or you can get treatment with different medications through prescriptions. How do you go about treating PDD different because it's chronic than a traditional event of depression?
So I would say yes and no. No, in the sense that like an acute depressive episode, persistent depressive disorder responds both to medications and to therapy. And there are some evidence-based therapies like cognitive behavior therapy that are known to be particularly effective. And there's some evidence to suggest that it responds best to a combination of both. And so if you can access both medications for depression and psychotherapeutic treatment, you have the highest likelihood of improving. But it also, by virtue of its persistence, may have a particular benefit from psychotherapy, because not only does a person have to deal with their depressive symptoms, but as they start feeling better, they have to adapt to being a somewhat different person. For people who say, I never remember feeling differently than this, when they begin feeling differently, they may be a little disoriented and have trouble adjusting to the new them. And that's where psychotherapy can provide additional help.
Yeah, and I think that's something that a lot of people, hey, once I get better or feel better, how am I going to live my, I'm say new life, but it's not really a new life. It's just maybe a better life. Dr. Appelbaum, you talked about prescription, you talked about therapy. Many Americans have health insurance. Some are covered by Medicare. Some don't even have health insurance. Do a lot of these, are these therapies that we're talking about in these prescriptions available to people across the income sphere and people across all demographics? Should they have or not have insurance?
Yeah, it's a very good question, and of course reflects the mess that our health care system and health coverage is in the United States compared to many other prosperous countries around the world. It is undoubtedly hard for people who don't have insurance and don't even qualify for public insurance like Medicaid to get access to medical services of any kind. And that includes psychiatric services or the assistance of a mental health professional. Nonetheless, there are community mental health clinics that exist in many areas that exist specifically to care for uninsured or underinsured populations. And I would advise people who don't have insurance and can access this kind of treatment directly to see what's available in their area. They may be surprised. Also, the new 988 hotline that has been put in place around the country, all you have to do is dial or text 988 is a resource for connecting with those kinds of places that can provide care regardless of insurance coverage. And that's something for people to keep in mind as well.
Doctor, lastly, I want to focus on the research, and there's a lot of research in terms of drug development, not just to depression and PDD, but what type of, but in all areas of medicine. And often we talk on this program about preventative care rather than reactive care. What type of research is being done in this specific area and in the area of depression? I know there's probably a laundry list, but in generality, sir, what do we have to look forward to on the horizon in terms of opportunities to get better?
So there are a lot of innovative approaches to depression. Depression is one of the most prevalent and disabling mental disorders. And there's been progress recently. So among the innovative treatments that exist are new types of what's called TMS, or transcranial magnetic therapies, magnets placed on the head and with their polarity rapidly reversed, that have a positive effect on depressive symptoms. There are also innovative molecular approaches. Ketamine, which began life as an anesthetic, has been approved in a intranasal formulation, esketamine, for the treatment of depression. And there are active trials now going on with regard to psychedelics and whether drugs like psilocybin could actually have a powerful and lasting effect on depressive symptomatology. So people should definitely stay tuned. There are going to be some really exciting things coming down the road here.
Yeah, and especially post-pandemic with the mental health concerns for many Americans, timing couldn't be better. Dr. Appelbaum, great to see you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Well, it was great talking with you today.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest curated news on lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content, then visit our website. We're back again tomorrow with another edition of BRN Weekly. That's easy for me to say. I'll be joined by Jane King to help break down the markets, and then we'll be taking a look back at some of our best segments for the week. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.